Hello, my name is Jennifer Huang. I am a pharmacy student at UConn School of Pharmacy, and my partner for this project is Iram Nasreen, a fellow pharmacy student. I will be presenting for the both of us about the role of pharmacists in an interdisciplinary approach to malnutrition prevention and treatment. Just before we start, a disclaimer. No conflict of interest, and this presentation does not constitute medical or other professional advice and should not be taken as such. So, what is malnutrition? Malnutrition is defined as an acute, subacute, or chronic nutrition imbalance that has led to a change in body composition and diminished function. This imbalance can be classified as either undernutrition or overnutrition. So, malnutrition is associated with many adverse outcomes, including impaired wound healing, immune suppression, and increased infection rate. This can lead to longer hospital stays, higher readmission rates, and increased mortality. This places a heavy burden on the patient, the clinician, and the healthcare system, so it's really important that we prevent and treat malnutrition. So, what is an NSP? An NSP is a nutrition support pharmacist. They are specialized in optimizing nutrition support therapy for patients, and they do so while collaborating with other healthcare professionals. So on the slide, we have listed what the scope of practice for an NSP may include. However, not all pharmacists perform all the roles listed. For example, not all pharmacists are involved in direct patient care. They may be doing their assessments with information collected and documented by someone else on the team. So the roles vary from institution to institution depending on how much pharmacists are involved at that location. So are NSPs the only pharmacists involved in nutrition support therapy? No, there are other pharmacists that can also perform tasks related to nutrition support therapy, but an NSP is specialized specifically in nutrition support therapy. So NSPs will be the focus of this presentation. So for NSP qualifications, an NSP must be a licensed pharmacist that devotes at least 30% of their professional practice time to nutrition support related activities. These activities include assessing a patient's nutritional needs and selecting, modifying, and monitoring their specific nutritional support therapies. It also may include compounding and dispensing parenteral nutrition admixtures. They also take part in nutrition support service policy and procedure management. They are involved in educating and training others and promoting safe and effective nutrition support via committees. They also need to have additional training after pharmacy school, which can be through a recognized formal education and training program specific for nutrition support therapy, or they can be certified by either the Board of Pharmacy Specialties as a BCNSP or the National Board of Nutrition Support Certification as a certified nutrition support clinician. So what is a nutrition assessment? So in collaboration with other healthcare professionals, an NSP will participate in nutrition assessments to identify patients who are nutritionally at risk via patient interviews, medical records, biochemical parameters, but usually another team member will identify patients that need nutritional support therapy and the pharmacist will assess the appropriateness of it. So the NSP considers patient-specific factors such as disease states, risk factors, and prognosis. The NSPs will also participate in assessing the patient's energy, protein, vitamin, mineral, fluid, and electrolyte requirements. They should also consider age, disease states, clinical outcomes and conditions, and pharmacotherapy to determine what this patient's specific needs are. They will also aim to prevent and or identify drug-drug or drug-nutrient or nutrient-nutrient and drug laboratory interactions and or incompatibilities. They will also assess for patients' risk for complications related to nutritional support therapy, such as formula and feeding access related complications. So getting into developing and implementing the nutrition care plan in collaboration with other healthcare professionals, the patient and the caregivers, The NSP will participate in developing and implementing a nutrition care plan. So this plan should be individualized, appropriate, and safe, and accurate for the individual patient. They establish goals of therapy, which include long and short term, which are both important part of the care plan. They review patient medications to determine the impact on the nutrition care plan and nutrient requirements. They can also recommend adjuncts to nutrition support therapy where it's applicable. For example, some include acid suppression agents, prokinetic agents, appetite stimulants, and antidiuretics. They will also provide strategies to prevent, detect, and manage interactions between drugs, dietary supplements, and nutrients. They want to prevent incompatible and unstable feeding formulations and achieve safe and effective strategies for administering medications through feeding access devices. For example, if a patient is on a controlled release medication, this is important to note because it can't be crushed and it can't be put through a patient's tube. Because it will no longer be controlled release. So there are certain medications that can clog up a feeding tube. So it's very important that a pharmacist evaluates the safety and efficacy of how a medication is being administered. So NSPs have a big role of reviewing orders, verifying, compounding, and dispensing feeding formulations. So the NSPs implement and adhere to policies and procedures relating to parental nutrition by order verification process. They ensure that orders are clear, complete, and correctly transcribed. They will confirm the appropriateness of the order and the order review process itself, including a clinical review, confirming appropriate indication, dosing, and compatibility. They will also ensure that compounding is safe and effective of the parenteral nutrition admixtures. The procedures are defined by the literature, guidelines, and standards of practice, such as USP Chapter 797, the Joint Commission, State Boards of Pharmacy, rules and regulations. NSPs will also adapt parenteral nutrition compounding policies and procedures based on availability of parental nutrition components and compounding related supplies. So continuing with the order review and verification process that NSPs participate in, they also look over the procedures to detect and prevent compatibility or stability problems, also participate in quality control procedures relating to compounding, for example, evaluating sterile compounding facilities to ensure that they're cleanly. They also participate in developing a competency-based educational curriculum for compounding. They will also adhere to policies and procedures relating to labeling, delivering, and storage of admixtures prior to administration, and also procedures related to the enteral nutrition ordering and review process to ensure preparing of safe and effective enteral nutrition formulations, and also labeling, delivery, and storage of these formulations prior to administration. NSPs are also involved in the monitoring of patients receiving nutritional support. They will do this by reports or patient visits. They will establish patient-specific monitoring parameters and monitor accordingly to optimize therapy and outcomes. They'll routinely reassess effectiveness and appropriateness of nutrition support therapy. For example, the feeding formulation, the route of delivery, and the delivery method. And lastly, they will also evaluate safety of nutrition support therapy provided. NSPs also play a big role in organizing and managing nutrition support services. So they will participate in maintaining technologies pertaining to nutrition support therapies, technologies such as computerized prescriber, ordered entry databases, automated compounding device software. They will also maintain an appropriate and cost-effective nutrition support formulary. They will also participate in administrative management of the nutrition support team or services, a team of physicians, nurse, dietitians, pharmacists, each with appropriate education and training. They will also participate as a member of and may coordinate or manage the nutrition support team itself. They will also plan or implement patient safety and quality improvement initiatives. They will also periodically review the nutrition support process, such as nutrition screenings, assessments, developing and implementing a nutritional care plan, monitoring, facilitating continuity of care, and or terminating therapy. NSPs also have a role in advancing the nutrition support pharmacy practice. They'll do this by developing collaborative relationships with healthcare professionals to advance this field of nutrition support. This will include other professionals like students, trainees, patients, caregivers. They will also maintain professional competence through continuing professional development. They will also promote communicating nutrition-related information and advancing the nutrition support pharmacy specialty. And this may be through publications and or presentations for healthcare professionals or the public. NSPs can also design, develop, or evaluate new nutrition-related innovations, including new products and equipment to influence positive changes in practice and outcomes. NSPs should always be looking at new research to stay up to date on standards of practice and new recommendations. If other team members hear there's a new way to formulate TPNs, they're going to run to the pharmacist with questions. So pharmacists can disseminate nutrition-related research findings through activities such as presentations, publications, and journal clubs. And this allows others to learn more about the latest research in nutrition support therapies and related activities. So these are the references we used in this presentation. Thank you so much for viewing this presentation. If at any point you had any questions, please feel free to contact us. Our emails are listed below. Thank you.